Frosty Serval is 23 years old, and he didn't eat breakfast this morning, and now flies are hovering around him. So we've called the vet, and Catherine is on her way with nets and a carrier, and we'll get him in to see the vet right away.
Back in with you, unfortunately, since you're going to be in an awkward position. Frosty's 21, 22,
23.
Oh gosh.
As of last January.
Oh, yes, it was, because he was 21 the last time. I'm going to get his tab. Hi. Only sort of sleepy. I took that canine tooth out of you once here, a long, long time ago. He's a little bit dehydrated. So before I have enough urine that we can kind of look at here, but we also want to do the urine culture. Where did his temperature end?
104.8.
So 104.8 is overheated as well. But he's been peeing on himself for a while to have all of the eggs, on him here.
I think he's probably been hiding that because
Yeah.
when I came up to him, as bad as he felt, he was trying to bathe his front feet.
Yeah. But we don't need a stroke filter. With his urine being so clear, the first thing we're worried about is kidney failure, and his kidney values were a little bit elevated last time he was sedated. So the question is, did they get much worse? If they did and he feels cruddy, then he might not get up, might urinate on himself. Diabetes can also make them urinate a lot and urinate on themselves, so we'll check for those things.
You are really good with that needle, whoever you are.
This is Shalise, and she is really good with
Nice job,
needles.
Shalise.
Thank you.
Kitty cats are a favorite of mine, even if they are bigger than normal.
So we're going to give him some sub-Q fluids for sure. I don't see any dental disease that could be causing this. There's definitely kind of some sort of heart poop in here, but he doesn't feel backed up like that he's completely constipated, but I'm going to feel in there. Would you rather check his blood first and see other things, or have big global picture no matter what? Like take his x-rays and have those before we start doing other things that might change the way his x-rays look.
Nadia's neck is so
Just in case.
Can you give us a close-up of those maggots?
The one's moving on my finger. No, I'm not wearing gloves. Yes, I should be. It's too late. I already committed. Changes there, but it doesn't look like fluid necessarily in his lungs. He has lots of that bridging, that spondylosis. You know how we talk about the vertebrae that should be like this, and as they get older, they get these little projections on the side that eventually grow over each other and make it impossible for their vertebrae to move independently. So it's really bad right here, but if you see, like, there's not really any there or there, but pretty much here, 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 like lots and lots of places where he has arthritis along his spine. So the other thing we're looking for is there a mass? Is there an obvious mass, a tumor, something that would make this have a different outcome? When we move back on his body, we still see more of that spondylosis, a lot of it right here at the base of his vertebrae where his pelvis is, so that makes it hard to posture, which could be part of why he's getting constipated, because it hurts to squat, to go to the bathroom. But this stool right here is hard, whereas this is more normal stool, and then this is gas in his intestines. His kidneys are here and here. They're about the same size. His bladder is big. And there's one tiny white dot right there, which could be the world's tiniest stone, but is really not a significant finding right now. When we turn him on his back, we get a different view of the heart, lungs, and his body, because now instead of being superimposed over each other, we're looking straight down. And that's his microchip. Everyone always panics when they see a white spot, but his lung fields of aging changes and his heart is kind of shifted. Part of that is it's hard to make such skinny bodies be exactly straight. So he's a little bit crooked, but this is his heart there. And then when we look at his abdominal cavity continuing down his body, we can see that hard poop right there. Kidneys are here, and this one is kind of hidden under his intestinal contents. His stomach is here, a little bit of his spleen there.
What kind of food? ID.
Give him some fluids because he has some kidney disease and his urine is dilute. He's producing more watery urine than he should. So that makes it hard to find bacteria in his urine because it's so dilute. There's so much extra water in there, it's hard to find the bacteria. So the best thing for us to do would be to send in a urine culture, but in the meanwhile treat him for a UTI, because why is he leaking urine everywhere? Leaking a urine that smells so bad that flies come to him and lay eggs there. So we'll give him an injection of Baytril at 1.5 mLs, and then we can use the long-acting antibiotic too, just in case he doesn't want to eat. We'll give him some more fluids. We'll keep getting those off. We're going to get some water to soften up that poo that's back there, try to get that out. I mean, he doesn't have heart disease, and that, you know, we're not going to have to sometime in the near future, but I think we have things we can help fix, but I would keep him inside for right now so we can make sure he stays clean back here.
Good thing all those bobcats just went out to rehab. What, yesterday, day before? No sooner
Okay,
do we empty the hospital.
So I need my syringes and stuff. I'll do that. Okay. And then we're 36 pounds. Can you get Serenia and Comenia? Okay. And then we can go back to some more fluids. Okay. Since we sucked that down.
While you're clean, do you want to get me an 18 gauge and I'll switch out with it?
Okay. Don't poop in their litter boxes because it hurts for something like spondylosis. So that's why you make litter boxes that have a beach entry, so they can like not have to climb in and go over and
Like
a dog. Huh?
All right, we need all of that.
Thank you.
Nice work.
Almost have to put it up against
like
the
Yeah.
wall, and now that there's been cool water in there. And then I used 0.5 of dextomator, so we're getting up to that point of, I don't know that I want to reverse yet because we still have bathing and shaving, but that's where we're headed. Then you can have all of your cool things go away, and we're not overheated anymore. Yay! Now,
Wow.